Welcome to episode 6 of Triangle Dentistry Talk. I'm your host, Dr. Carl Bernstein, and I'm here today with Dr. Sam Safadi from Triangle Endodontics. How are you today?
I'm doing very well. How about you, Carl?
I'm doing great. Thank you for giving us some of your time on a Friday, on an off day for you, to talk about endodontics and to educate everyone in the Cary and Triangle area. So tell us a little bit about yourself.
Sure,
What do you like
sure.
to do? Tell us about anything, how personal you want to get or impersonal. But really, our goal is to just learn a little bit about yourself and then a little bit about your office. So tell us a little bit about yourself.
Sure. Well, first, I want to thank you for having me. This is a great idea. We should have more of these, and honored to be invited to your podcast. This should be a lot of fun. So, as you know, I am an endodontist in Cary. I've been an endodontist in Cary for about 14 years now, here at the same office. If you want to know about my background, that's a long story. I've been in dentistry. I started in dentistry actually in the early '90s. I was really young, if we go back to the beginning, I went to dental school at Case Western Reserve University in Cleveland, Ohio.
And I like
Um,
everyone from Ohio. As some of you may know, I'm from Cincinnati. Even though we're not supposed to like Clevelanders, I like all Ohioans. So I'll take it.
we like our Browns and we like all of the Ohio football teams. But
Yes.
that's where I went to dental school. I had a great time in dental school, and during dental school, I developed this interest in TMD and orofacial pain. So after dental school, like many of us, I went back. I actually did participated in an AAGD program at Eastman Dental Center in Rochester, New York, part of the University of Rochester. And after that, I went back and I did my first specialty in TMD and orofacial pain at the State University of New York at Buffalo. And that's where I did my first master's thesis in dentistry. It was a combined program, so it was a 2-year residency, and basically we treated orofacial pain. Uh, all complex cases. That was more focused on a chronic pain. We did the boards, and I completed my first master's degree. So kind of that was the first episode. Then, between Cleveland and Buffalo was a little too cold, as you know. And I
Exactly.
decided at that time to relocate to the West Coast, to the Southwest, and I moved to Scottsdale, Arizona. In Scottsdale, that's when I started my first. At the time, I was a cosmetic dentist, and I started my first and second cosmetic dental practices, and I practiced in each one of them for about 13 years. After doing cosmetic dentistry and doing everything, from full veneers to full mouth reconstruction cases, uh, I decided that my real interest was in endodontics. That's what I liked the most. And I decided at that time that I was going to retire. I actually had a retirement party from general dentistry. And went back to again to specialize again and do my second master's degree in dentistry. And although I had many choices, I chose to go back to my alma mater, where I initially did dental school and went back to Case Western Reserve University and did my second master's degree in dentistry and my endodontic residency at Case Western Reserve.
So, how long have you been an endodontist for, and how long have you been in Cary?
So I've been an endodontist, for about 14 years now, and I've been in Cary for about 13 years. Um, and as endodontists are dentists that specializes in the pulp disease, so essentially in the nerves inside the teeth, and also in the surrounding area around the teeth. So we deal with a lot of acute pain, acute dental pain, as well as infections. So we deal with a lot of infections. That's what we treat in the oral regions. Any infections that are related to the pulp, to the nerves of the teeth. We deal with a lot of swellings, a lot of patients that come and see us are usually symptomatic. They have a
Hmm.
lot of pain, they have infection, and that's really what we specialize in.
And then
Um,
one thing that patients always think of, endodontists, they kind of relate to pain, but it's not true. Endodontist is going to help you get out of pain and make you feel really comfortable in the chair and during the entire procedure. I think being I think endodontics is one, in root canals, people are know that term more than endodontics. But I would say a lot of patients may be fearful of root canals, but I think Dr. Safadi knows. He's been around the block. He's done dentistry. He's done endodontics for what was it, 13 or 14 years? Many years, and he knows how to deal with pain. He knows how to deal with patients to make them comfortable. And so how is it that you deal with pain for root canal, or in just managing pain before a patient can come in?
Well, that's exactly right. So, dentistry and especially endodontics came a long way from, back in the 70s and 80s. So, you're right. That's the first question. Patients come in with pain, but they don't want more pain. So, really,
Right.
all our procedures now in dentistry, really, there are painless. We have so many different advanced techniques, advanced anesthesia, advanced sedation that people, and you ask everybody that went through a recent dental or endodontic procedure, and they'll
Hmm.
tell you they were surprised that uh, they experienced really no pain. Again, with the advanced equipment we have now, the advanced procedures, really all the procedures that we do are absolutely painless. If anything, as soon as the patients leave our office, usually we get, the thank you phone calls and the letters and the cards, and because they come in with a problem, and you know as soon as they leave, we fix that problem. And like I said,
And that's one thing, exactly like you kind of said. I've always heard is patients love their endodontist because, like you said, they walk in with pain and they walk out feeling wonderful. Maybe they haven't slept in a few days, and when they leave, they're feeling happy, and they love you guys. I mean, you guys are essentially saving them from sometimes a significant amount of pain.
yes, yes, and we see that every day, and people come and see us from far, far away sometimes. Although we are in Cary, we see patients. Patients come to us from as far as Wilmington. They come to us from Greensboro. Obviously, the whole Triangle region. So people come to see us because usually with endodontics, you're dealing with symptomatic cases. You're dealing
Hmm.
with a patient that's been in pain for a long time. They have a lot of symptoms. Sometimes these cases could go south quick, and that's why we always tell patients, do not, things will get worse. When you feel symptoms, don't ignore it, because usually prevention is really the best medicine. You really
Hmm.
need to do a lot of preventative work. But when you feel symptoms, don't think the symptoms are just going to get better. And sometimes, often, when they get better, the pathology, what we see, gets worse. So, an abscess gets worse, start to spread around. And a lot of times, if you neglect these cases, unfortunately, sometimes patients will end up needing a lot more care, a lot more complications occur. People end up in the hospital. So we always tell patients, the moment you feel, a little toothache, a little pain, that's when you need to seek care. Obviously, if you don't have an endodontist, your best source is to go to your general dentist. Have him check that area, have him take a look. It takes a few minutes, and if it's good, they'll tell you it's good. But a lot of times, what we see with these small infections, the problem always starts very small, and it snowballs from there. And that's why seeking care early on is really key, and really, solving these issues without having to go through, complications. But yes, a lot of patients come in with a lot of symptoms, and what we do really sometimes it's really magical in terms of how quickly we're able to resolve the problem before it gets a lot worse.
And Dr. Safadi had said, he sees patients from all over, really the North Carolina state in a way, sometimes a few hours away. But that's because, the reputation that he has built and what people know of him is he's a wonderful endodontist and he's a wonderful caregiver. And so, if you just even look, if this is the first time you've seen him, you can tell how caring he is and how comfortable he is with treating root canals or endodontic therapy. But at the same time, you know, we want to be able to get you guys in, and that is why sometimes people drive from so far away. Is Dr. Safadi is able to get patients in and able to see new patients as well. So to that saying, some patients don't have a dentist. Or haven't been to the dentist in a few years and they're having some pain. Are they able to get in contact with you, and are you able to help them if they don't even have a general dentist?
Absolutely, and we definitely, and that's when we a lot of times where we see the issue when things happen, especially in the past few years with the pandemic.
Hmm.
Unfortunately, people who were really good at going to the general dentist every 6 months or every 3 months, because of the pandemic and obviously kind of everything that everybody went through, sometimes that 6 months recall now was pushed out a year, 2 years. So things got a lot worse in terms of what we see in the oral cavity in the mouth. Sometimes people, a patient who had a dentist now, they moved, they don't have a dentist, so we're definitely able to see the patient and take care of the problem. And then obviously if they currently don't have a dentist, we definitely we have good relations with so many wonderful dentists. We're lucky in this area. We have a lot of amazing general
Hmm.
dentists. And we as a specialist, and I'm sure Carl, you say the same thing. We see the amount of care. I mean, like, I always tell the patients in the Cary area or the Triangle area how lucky they are because access to care is really not an issue. There's a lot of
Exactly.
wonderful dentists, great dentists. And we have great institutions here as well. UNC Dental School, one of the best in the world. So we're really, in good hands here. Really, there is no reason not to make sure that we're doing a lot of prevention. So if you don't have a dentist and you're looking for a general dentist, we can definitely help you out and connect you. Depending where you live, kind of what you're looking for, we could definitely as a specialist connect you with a lot of our amazing general dentists.
Well, great. Well, we're going to soon get into a little bit of of endodontic treatment and exactly, how an endodontist differentiates itself from a general dentist. But before we get into that, you mentioned UNC, and I know that you teach as well, and teach at UNC and teach at other areas, and also teach maybe some of the general dentist of endodontics and root canal therapy. But I think that is one thing that makes you. Such a great clinician is that you are able to teach other people as well at the same time as giving care to our wonderful area in the Triangle. But if you wanted to, you could tell us a little bit, just a little bit, about your teaching experience and how that also furthered your career in knowledge and of education in endodontics as well. But go ahead.
Yes, yes, absolutely. Teaching is very rewarding, as you know, Carl, because as an endodontist, all I do now, 24/7, we're focused on endodontics. So, that's what So when you do something, so we treat hundreds of thousands of cases over the years that are focused on endodontic care. So the knowledge we have from just what we do on a daily basis is I think so valuable to the general dentist, and we like to share it. And so teaching has been very rewarding. How to can, especially with the new research and the new advancement we have, not only in the dental field but the endodontic field itself. I mean, the amount of research we've done over the past 20 years and the new procedures we do now, it's a lot different than what we did 10 or even 10 years ago.
Exactly.
We definitely came a long way. So we really like to share that knowledge with our colleagues. And for us, it's very rewarding. And that's one of the things I really enjoy doing very much is consulting with our colleagues and our friends who are clinicians, and just sharing our knowledge. Because although a lot of our colleagues, a lot of our general dentists do uh, a lot of endodontics is a discipline out of the general dentistry, but they are so busy doing so many other things. They do so many different disciplines in dentistry, from prosthodontics to doing dentures and periodontal treatments,
Hmm.
cleanings, fillings. So they stay pretty busy. So we try to kind of help them with this area, and try to advance their career as much as possible in the field of endodontics,
Well,
especially when
that's
it
great.
comes to the
Yeah.
new procedures, that we have in our field.
And that's great. Teaching is very rewarding, and it also takes a lot of patience. So, we appreciate you giving your time as well to give back to the field, and hopefully able to help us and help other dentists and endodontists take care of their patients. So now we've touched a little bit there. Let's talk about the field of endodontics, and how is it different when you walk into an endodontic office versus a general dentist office, and what makes an endodontist so special and so unique in giving care for endodontic, root canal therapy, etc.
Right. So, our field, obviously, uh, all we do is endodontics. So, what differentiate an endodontist, just like yourself, other specialists, is that we
Hmm.
do a lot more schooling. So a lot of endodontists have obviously went to undergrad. After undergrad, just like the other general dentists, they went to dental school for 4 years. Now, after dental school, endodontics usually will go and do a GPR or an AHD program and practice for several years, like myself. I was in practice for a long time, so I gained all the knowledge in the cosmetic and the general dentistry field. Now, after that, you go back to school and do usually at least 2 to 3 years. If you're doing a combined program, if you're doing a residency and a master's degree, that's usually 3 year program. So in addition to the 4 years in dental school, you're doing an additional 3 years. And during those 3 years, you're just focused on endodontics and microsurgery. And that's where you become specialized in using the advanced equipment, um, you know, which differentiates you from the general dentist. So now, as an endodontist, all our procedures are done using the surgical microscope, um, and all the procedures are done with the advanced use of magnification, as well as other advanced equipment, such as we obviously use 3D imaging for most of our cases now. So we use CT scans, CBCTs. We use lasers in treatment of root canal treatments, as well as the gentle wave system. So we use a lot more advanced equipment because that's really what we do. All our surgeries are done via the microscope, which is less invasive than, and that's also true in the medical field as well, where
Hmm.
now a lot of the procedures are becoming less and less invasive. So you really, whenever you want to go through any type of procedure, you want a non-invasive procedure, and that's why we employ the surgical operating microscope. It's the same microscopes that neurosurgeons use when they do neurosurgery or spine surgery, except we use it to in the mouth. We use it inside the teeth and around the teeth to perform all our treatments. And again, that is assisted with lasers. That is assisted with usually guided by CT. So we're really using the state of the art, most advanced equipment that is out there, and we are trained. We are trained on that, and that's why it takes almost additional 3 years for us as opposed to 4 years. Or after the 4 years of dental school to get trained in this area. Uh, but again, because of that, that's all we do. So an endodontist, does not do any restorative dentistry. We don't do
Mhm.
cleanings. We don't do fillings. We're just focused on treating, infections of the pulp, the surrounding area, and we usually team up with your primary doctor, your primary dentist, to complete your treatment. So a lot of our cases are, cases that are referred from the general dentist for us, for our expertise in this area, and then, usually you'll go back to your general dentist for restorative work, and that is usually a restoration, a crown, an onlay. Because, like I said, for us, we're just focused on those endodontic treatments.
Exactly. And I think that's important for everyone to hear as well, is that the endodontic or root canal therapy or whatever it is you have done, which we'll go over some treatments that endodontists do, but it's not the end of the treatment. You still need to make sure that the filling or whatever long-term restoration is completed on top and after the endodontic therapy. And I think some patients may get out of pain and say, you know what, that's great, I feel good, let's continue on. But there still is a little bit more restorative work with your general dentist that does need to be done. But, you've been talking a little bit about treatment. What treatments, I think most people, and even myself, and I'm a dentist, and I, went to dental school for 4 years, and then I did an orthodontic residency. I didn't practice specifically in dentistry after finishing. I went directly into residency program. But endodontists do a lot more than just root canals. I know obviously that's the number one thing everyone knows is root canals. But what else do you guys do? What else specifically are you able or that you do at your office at Triangle Endodontics?
Well, that's exactly right. So really, I mean, the last thing we want to do really is to do a root canal therapy on a tooth. We like to keep teeth vital for as long as possible. The last thing we absolutely need to do is extract a tooth or lose a tooth. So, what we do is really an attempt to obviously save the tooth, and we're very
Mhm.
successful at it. So obviously, people think, well, an endodontist does root canals. Well, we work inside the root canal most of the time, but a lot of our procedures go beyond your typical endodontic treatment or your non-surgical root canal therapy. Uh, so our treatments are geared towards a lot of times making sure that the tooth remain vital because that's really what's going to give you the best long-term prognosis. So we have a wide range of treatment options to keep that tooth vital and keep it alive, basically. From vital pulp therapies to the advanced regenerative endodontics that we've been doing now for several years. And I can touch upon that a little bit, but really, we do a lot of endodontic treatments, but our main goal really is to keep the pulp vital, to keep the tooth alive. We don't like dead teeth. We don't like
Exactly.
necrotic teeth. We like teeth to remain vital, and that's where a lot of the research in the past, I would say in the past 10, 20 years, been towards how do you keep the teeth vital? How do we maintain and save our teeth? And there's been a lot of research in the area of regenerative endodontics, where essentially not only we're keeping the teeth vital and alive via vital pulp therapies, but now we're doing a lot of making the tooth live after it dies. So we're with regenerative endodontics. What we do, we essentially grow the nerve back inside the tooth after the nerve had died, and that's really what we want. That's what we want. So obviously, we do root canal therapy. That's a procedure where we take the damaged nerve or the infection out of the tooth, and we fill the canal. And again, that's all done microscopically with guided CT uh, inside the tooth using lasers and gentle wave to make sure all the infection is gone. So that's definitely the common procedure that everybody knows about. We do endodontic retreatments, and with those treatments is again done microscopically, where we go through the tooth to remove infections that started around the tooth that had a previous root canal. and that's something that again we've been doing for a while. Uh, the other common procedure that we do microsurgery. Microsurgery, that's again, it's done via microscopes as well. And what we do is we go around the teeth where there is lesions and infections. And those range from granulomas to cysts to chronic abscesses to, uh, acute problems. And we surgically treat them and sometimes place bone grafts in those areas. And that's what, that ranges from doing apicos and retrofills to doing root amputations, hemisections, and all these procedures that we've been doing for a long time. In addition to that, uh, we do intentional replantation, and that's where we go in and we take a damaged tooth actually out of the mouth. We would remove it for a little while, and we fix it outside your mouth uh, while you're just sitting there and listening to music and having a good time.
Right,
So we're
watching
not doing the
TV.
drilling inside your mouth. We just simply go in, take it out. We fix it outside the mouth. When we're done, we just put it right back in, and that's what we call intentional replantation. So
And
as
so
you could see, we go the extra mile to save every tooth. There's other procedures that usually are referred to us, from epixification to epixogenesis. Those are procedures that are done on damaged teeth that are immature, usually on younger patients.
mhm.
That's something that we obviously, you know, we see a lot of. Uh, we treat a lot of dental trauma cases, usually sports injuries, teeth that, fall out because, during sports, the tooth get knocked out. That's what we specialize in as well.
And that's
We
and just to cut you off just a little bit there, but just to add some is, I'm an orthodontist here in Cary, and sometimes work close with Dr. Safadi and in some patients. And I think what he hit on is, you know, how does endodontics and orthodontics always relate? And we're very lucky, like we said earlier, is that we have wonderful dental offices, dentists, specialists in this area. So most patients do have wonderful dental care. But one thing that he just mentioned, and very common in kids, is trauma, especially kids riding a bike, and kids around 12, 14, 15 years of age do have braces. And so this is where a lot of the times we'll, sometimes be referring to the endodontist. We'll get a call and it's always, after school or late in the evening, and my kid was riding a bike and they fell face first and the tooth chipped and it's starting to bleed or it's hurting. And those are times when we definitely want to refer to the endodontist and to discuss about how to save the teeth. And as you've been hearing him say, is endodontists, their main goal is to save a tooth, and we don't want you to lose any teeth. So, how is it, when it comes to trauma like that, what are some of the steps that need to be taken for those patients to be able to save those teeth, and not just for the short term, but obviously these are young kids for 50, 60, 70 years.
Right, and that's a very good question. And we are now, we're in June. We're the start of the summer, right?
Yeah,
So
this
I'll
this
tell
is
you
the
over there.
number one time for accidents.
Exactly right. Kids are out of school, and we want them to be active, and I don't know if, as you know, probably, I'm big into sports. I actually, I coach basketball. I coach and I've been coaching basketball probably for 10 years. I coach the Blue Devils, but not the Blue Devils of, the Duke Blue Devils. I'm a coach with the City League, so I coach basketball. So, the number one, and again, we see a lot of trauma, and usually, unfortunately, I see these cases after the trauma occurred. But I always say the first thing before you play basketball or any other sport, you have to get a mouth guard. You have
Yes.
to. You gotta go see your dentist and get a mouth guard. It is not costly, but it really will help a lot. Trauma cases are very, very common. I'll tell you, in June, we've got almost a case every day, a trauma case. Whether that's an avulsed tooth or a tooth that has been, fractured. We've got since the start of June, since school has been out, because kids are out, they're out in the fields, and we want them to be active. That's a good
Yes.
thing. We want them to be out. We want them to be involved
I
in
know, away from the
sports,
TVs, away from video games, even though
from
I
the
loved those as a
smartphones,
kid,
and the
try to get
yes.
outside.
Yes, absolutely. And my kids are the same. I want them to be active, but the first step really is to get a mouth guard. Talk to your general dentist and get that mouth guard. Again, that's a saver. Now, beyond that, when the trauma occurs, again, we have timelines. And most parents are pretty good. I see parents, a lot of parents are already trained. But the first step after the trauma occur, always seek care. Call us or call your general dentist or your orthodontist, um, and let them know what happened. Now, that doesn't mean that the tooth actually fell out.
Mhm.
Obviously, that's easy because if your kid come home and they're holding their two or three teeth in their hand, you're gonna go and seek care. But
Now,
even
before
if
before you continue on, if that does happen, hopefully it doesn't. We obviously see it in hockey, and professional hockey players love to show their mouth with no teeth. What do they do with that tooth if it did fall out because it avulsed and now they're holding it? Where should they hold that tooth before they can get into you?
well, the best way. So if the tooth comes out and you feel comfortable, if you feel comfortable and the tooth comes out, I try to put it back in.
Let me ask you this. Let's say it comes out, they're playing football or soccer, and it's dirty. Then what should they do?
Well, we definitely want to clean it out. At that point, really, we have an hour. That's a golden hour, as I call it. What you want to do is contact your dentist immediately. So the first step is the best outcome will be if you're within an hour, you're able to get in, call your dentist, or if it's during the day, I would take your child. Now, obviously, barring any other injuries, because some of the injuries could be more severe, where obviously we
Yes.
want to make sure we rule things out. Obviously, depending where the injury or what it is. Now, again, we're talking about simple sports injuries because,
Mhm.
you know, I'm on call sometimes and I go to the ER for more severe injuries. I'm not referring to major trauma or anything like that, because for that, obviously, you have to seek care. You have to go to the emergency room, right? We need to rule out bigger issues, as well
Mhm.
as the dental issues we'll take care of. But if it's a simple tooth trauma, it's limited to a tooth, limited to that region. Your best source to be is to go to your dental office within the hour. If you see the tooth, you're going to take it, collect it. If it's a broken, try to collect what you can. Bring it with you. Don't leave it behind, and go to your dentist. We have 60 minutes. Now, if it's beyond that, obviously be safe, take all the appropriate measures, but go see your dentist. Now, if this happens over a weekend and your dentist office is closed, then give them a call. All of our
Mhm.
colleagues, including us, we have emergency numbers. You will call us and we will respond. The best time to put the tooth back in place, if we're talking about if the tooth has avulsed and fell out, is within 60 minutes. That's where you're going to get the best outcome. Now, obviously, if it's beyond that, and say you are out camping somewhere or you're far, follow the same procedures, even if it's beyond an hour, but you're going to get the best outcome if that tooth is back where it belongs within the hour.
That's good to know because especially like you said, being summertime, it's definitely going to happen to someone. Hopefully not. We don't want it to happen to anyone, but we know accidents do happen. And being an orthodontist, I do get that call a lot. And obviously you can come in and I'm available and always able to see any patient for emergencies. But sometimes here at our office, we don't have all the equipment to be able to help you as much as your general dentist or a specialist such as an endodontist. But we are very lucky to be in this area with a lot of dentists, a lot of expert dentists that are able to help manage that care for you. So let's sidetrack just a little bit. You had mentioned earlier you do a little bit of oral facial pain management. What exactly are you looking for in that, and kind of touch on a little bit of what exactly you may do for that, and also additionally, there are some referred pain that you get with oral facial pain, and how do patients deal with that and understand it, and obviously because of that, that's why you have patients to inform them. But how do you deal with that oral facial pain management?
Yes, absolutely. So we touched upon a little bit on acute pain. So that's where we're dealing with the toothache. There's pathology inside the tooth that's causing that pain. When we talk about orofacial pain, now we're talking about more chronic pain. It's a different type of pain. Now, obviously, a lot of the cases sometimes I see involves the differential diagnosis between the two, because sometimes the source of the pain is different than where the pain is. Now, with a toothache, you're able to point to the tooth and say, this is the tooth, and let's look at it. Let's do a CT scan or a CBCT. Let's look closer at the nerves in it. Let's look at the surrounding area, the supporting tissues, the periodontal area, and see if that's what's causing the pain. Now, that happens sometimes, especially with the acute pain cases. In other cases where the pain is actually started somewhere else, right? We're dealing with referred pain. That's more chronic pain cases, and there's a lot of them. So sometimes you feel my tooth hurts. You go to the dentist. The dentist look at the tooth and say your tooth is fine. I don't see a problem.
Mm-hmm.
But you think the tooth really hurts, and you're right. Your tooth hurts, but the source of your pain is coming from somewhere else. Now, as we all know, our nerves are all connected. The nerve inside the tooth is connected to the nerves outside the tooth, the nerves into the jaw area, and actually throughout the body, all of our nerves are all connected. So with orofacial pain, we look more specifically at sources of pain. And there's a lot of sources of pain. We treat a lot of myofascial pain, which is muscular pain that sometimes mimic toothaches. So sometimes you feel like you have a toothache, but really your pain is coming from a different area. You're coming from the muscles. We treat a lot of TMD, temporomandibular disorders, a problem with the joint, the temporomandibular joint. We treat a lot of disc displacements that causes the jaw to shift in a way where causes pain and discomfort. We also deal with a lot of different neuralgia, from trigeminal neuralgia to cluster headaches to tension type headaches. So there's a lot of atypical pain cases that we treat as part of our orofacial pain discipline. And that ranges, our treatments. And again, we like conservative, non-invasive treatment. That's our first step. But that treatment ranges from, pharmacology, where we use muscle relaxants and, other, straightforward medication that we know that it's proven to manage some of these, you know, uh, neuralgia cases or myofascial pain cases, but also it goes to using appliance therapy. As far as surgical cases, from TMJ disc replacement to TMJ replacement. So the treatment is wide, depending on the case. But the majority of the time, we always start with non-invasive conservative treatment to address the pain. A lot of those cases are multidisciplinary cases where we have a team. So I work very closely with a lot of the ENTs in the area, the neurologists in the area, and we share a lot of cases. So those cases, with endodontics, a lot of my cases, I work closely with the dental community, with the general dentist. Now, a lot of my orofacial pain cases, I'm working closer to. Usually, the patients are referred from ENTs or neurologists, because a lot of those cases start, the same way they start, like with mimicking a toothache. A lot of times they start mimicking an earache, where people go to the
Mm-hmm.
ENT. They say, "I feel I have an earache." The ENT use a scope, take it inside the ear or the sinus, and everything is clear. So those are the cases that gets referred to me sometimes. To basically, and really the hardest part of these, the challenging part of these cases is the differential diagnosis.
Exactly.
And we do a full workup from, like I said, from full imaging, MRIs, sometimes lab work to find out what's really causing this type of pain. And a lot of it is definitely challenging. But again, we always err on the side of starting with non-invasive treatment.
That's great that you offer that because a lot of dentists don't really do treatment for oral facial pain management. It is very difficult to diagnose, just like you said. And it's something that really takes a passion of wanting to
Yes.
do and understanding the patient because it sometimes is hard for the patient to really describe what symptoms they're having because it's so broad that it seems like it could be anything and it's hard to pinpoint where those issues are from. So it's definitely great that we have someone in our area that is able to manage those patients and to take care of them. So for that, we
Yes.
definitely appreciate your care there. I have one more question, and then really anything else you'd like to leave us on. But that final question I have, which actually in my office I saw it pretty recently, is with orthodontic treatment, and we started to see some tooth color change on the front tooth. And really, we I understand, why that can happen, but really, someone who really specializes in that, what is a cause of why sometimes people will get that tooth change with a little bit of tooth movement, or which is not that common, but sometimes this will happen even without orthodontic treatment. Kind of give a little bit of explanation of that, and maybe a treatment that you may use to fix that problem.
Right. So you're exactly right. Sometimes, we see discoloration. Now, when you look at discoloration, first we need to differentiate to see, are we talking about a generalized discoloration? Obviously. So in other words, most of the teeth are getting dark. And a lot of times that's something, we could definitely address with, different products or obviously more cosmetic
Hmm.
bleaching, things like that. Now, I think that Dr. Bernstein, that the case you're referring to would be when we start seeing a single tooth change
Yes.
shade. In other words, we're seeing this one tooth changing shades, and usually we're seeing, 4 or 5 shades darker than the adjacent teeth. So, the patient starting seeing that does change. Now, that could indicate an issue. It could indicate couple of issues. First, the tooth could be starting to die. In other words, the pulp or the nerve inside that tooth could that an early sign that that nerve is becoming necrotic. So we're dealing now with possible pulp necrosis, which means that inside the tooth the nerve had turned into infection. For that, you do have to seek care. So if you see your tooth getting darker, one single tooth, that's when you want to go to your orthodontist or your dentist and find out. So the first thing they would do is really to take a closer look at the nerve and do what we call vitality testing. And there's multiple tests we run on the nerves to find out the condition of the nerve. Now, a lot of times, unfortunately, teeth could die, and that's something we see. And with the advancement of regenerative endodontics now, we're able to, if the nerve inside the tooth dies, for ages, we always thought, well, that means the tooth is dead. And that means we have to go in and do endodontic treatment. We have to do root canal therapy. Now, with the advancement of regenerative endodontics, what we can do now for the teeth is really go back in there. First, we take the infection out, and then after that, we will grow the nerve back inside the tooth. So think about that like growing a plant, right? What we do is we go back in there and we use the stem cells in the apical area, which means that's the tip of your root. We take a microscope there and we go to those stem cells and we use those your stem cells
Right.
that are
From
in
that
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 region.
person. Right.
Right, right. We don't add anything from the outside. We use those stem cells to grow the nerve back in. So although the tooth became dark, we could make that tooth live again. We could bring the nerve back in there. This is what we used to call revasc, or what we call now regendo. which is a short of regenerative endodontics. And that's a very, fast growing field. We've been doing that now for a few years. So that is an indication why a tooth could go dark. Now, obviously, sometimes it's actually the other end. The tooth goes dark after it calcifies. What happens sometimes, it's a body mechanism to protect itself, and it essentially calcifies the pulp, or where the nerve used to be. And that's also where you should seek care, because before it's too late, we're able to treat that as well and save your tooth. So that sometimes could indicate a problem. But it always starts by us going back in there and running our vitality nerve testing on the nerve inside the tooth to determine the condition of it.
Perfect. And, I appreciate you giving an answer to that question, because it's something in orthodontics we don't see too frequently. I mean, maybe once a year, or maybe every few years. It's not that common. But when you see it, it always seems to happen on a front tooth. And obviously everyone wants their teeth to look better. And so, definitely want to get that corrected. And now we have a few answers on how to get that corrected. So we appreciate that. I don't have any more questions for you for this podcast. Anything that you would like to leave us with? Any knowledge, any information for us and possibly future patients?
Yes, well, this is what was a lot of fun. Appreciate you inviting me on the podcast, and I really enjoyed it very much. So yeah, I mean, for our patients, as I always say, make sure prevention is number one. I mean, that's what we want. We want to do a lot of prevention. So definitely, I know we had a big pandemic a few years ago, and if that made you delay care, I always encourage you, go back, see your general dentist, make sure you're on a good recall, because in the long run, that's going to be will save us from a lot of issues. Like I said earlier, the issues we see are usually when care is delayed. So really, always let's focus on prevention. That's what you want to do. Get those checkups done. You should see your physician once a year for your physical, but then see your dentist every 6 months. Make sure that they fix the problems when they are small. Make sure they are using the sealants and the fluoride. So hopefully, we talked about a lot of treatment options here, but really the goal is really never to get there. We don't want, to get to the, and we could definitely take care of a lot of problems, and we have a lot of advancements now to make sure that we do that painlessly with the advanced equipment and procedures. But really, the key here is prevention. So we want to prevent all these issues, because prevention is the best cure, really. And make sure, I always tell my patients, see your general dentist every 6 months, get your cleaning, get your checkup, and make sure any small problems are addressed when they are small before they get worse.
Well, perfect. Well, thank you again for giving us your time. This was Dr. Sam Safadi with Triangle Endodontics. I was your host, Dr. Carl Bernstein, and this was episode 6 of Triangle Dentistry Talk. Thank you.